Alright, this finalizes 28 teeth. 28 teeth. Alright, so 28 design, 3-unit bridge, side view, cushion contact, facial cutback. Things is vocal side, inside you want to make out and up high, both sides. Inside you want to, no, I think it's out, yeah, out. No, I mean inside you want to, a little bit more. Yep, that's good. The other side too, especially this. Okay. Outside. Okay, occlusion view. It's good. We're trying to diminish the okay. Upper. That's good. Alright, this finalizes 28 teeth. 28 teeth. Okay, beautiful aesthetics. Another lucky patience. We finalize it. We get the centric, which is a bite. Contact. And here is the occlusion. So basically we design with all zirconia top, zirconia, so protect fully. Right? And then we made a good aesthetics, good design. Like this. Okay. That's good. Now we're talking about the lower. It's mono as well, and we're trying to minimize it, individualize as much as possible. It's 3-unit bridges here. There's kind of little limitations, but it's like pretty beautiful aesthetic. Height, K9, vocal corridor, curvable spear inversion, beautiful. Okay, so we'll make the CJ. Just like little indentations, so tooth shape and contour. So here is this story. Doctor gave us the pre-op model. Okay, so pre-op model has one dentition just like that. This is the patient has it. So we just increase it just a little bit, and doctors make the temporizations, missing teeth, broken teeth, grind the teeth, right? Here, especially lower, so decay here. And doctor made a pretty good temporizations from this. Unfortunately, when we got it, this is broke. But I can tell 8 and 9, 6 and 7 and 10, 11 posterior teeth is 4-unit bridge. He took the great impression. Okay, which is I like spit eye for this. Nice. But his impression is really good. So we made a pin model. It's like that. Okay. And then he gave me the baseball. And we have a stick bite. Okay. And then we're mounting here. Okay. So after we get it, and this is the final work for this. All right. Okay, so this is 28 teeth. The luxury case is going on. As I give him this, is my labor, which is great guy. They support quite a bit. I said it's lucky patient. All right, so they got top of the line the product, size of the tooth, texture, incisal translucency, everything. Nice. Class 1 bite, So that one's a before and after. Awesome.